From our schools to our homes to the workplace, the impacts from the coronavirus impacting all of us. I'm Erica Bryant.
And I'm Scott Wickersham. There's been a lot of reaction, but let's just look at the facts. Again, tonight at 6 o'clock, the number of cases in our area. In Mecklenburg County, a population of over 1 million people, there is just one case. And yeah, that number was 2 yesterday, but it's actually just one. Cabarrus County has 1 case and Lancaster County has 2. In Kershaw County, though, they do have 13 cases.
In the past hour, the South Carolina governor ordered that Lancaster County schools be closed. Iredell Statesville schools just extended spring break. Their first day back to class will be the 23rd now. And we know that the CMS district, by far our largest district, met with the health department officials this afternoon, and CMS just announced plans for an emergency meeting to be held at 7 o'clock tonight. We will bring you an update on what happens there. We have live team coverage tonight at 6 o'clock. Our reporters are meeting with doctors, business owners, and school districts.
Yeah, let's start off with education reporter Elsa Gillis. CMS emergency meeting at 7 o'clock. Elsa, other states, entire states are canceling school now. Steve said Florida. We've had Pennsylvania today. That just puts a lot of pressure on districts like CMS. What are you hearing?
Yeah, and Scott, we might get more clarity tonight on what the district is thinking as far as whether or not to close schools. That meeting is happening in just about an hour at the Government Center, and that's where I'm headed right after coming to you live here. And this is a delicate situation. Weighing whether closing schools makes scientific sense to control the spread of the virus and the impact to families. CMS has a diverse socioeconomic population. We know many students rely on school to get their meals. Many students don't have access to the internet or a laptop, so doing work at home would be a challenge. And then, of course, as students are kept home, many parents can't go to work, which is incredibly impactful for the whole family and local businesses. At this time, both the state and county health department have not recommended that schools close, but we know that CMS is preparing behind the scenes in the case they have to make that difficult decision.
I think that they should close the public schools as well as the court systems, as a matter of fact, because this coronavirus is very serious. And as you know, as a parent, I'm very concerned about that, and as a citizen.
I think whatever measure is being taken by CMS, then I think it's appropriate to help stop the spread of this virus because it's very serious.
And we've seen communications today from CMS to parents about the district-wide plan they are coming up with in the case they have to close schools. So, for example, one high school sent a note to families telling their students to come pick up hotspots and Chromebooks in the media center if that's not something they have at home. They're also talking about getting kids meals if that's something they rely on as well, Scott.
All right, Elsa Gillis live tonight. Thank you very much, Elsa. Also tonight, we do know that Union County Public Schools actually canceled before and after school activities, suspended until further notice. And I'm reading an alert I got here a short time ago. District-sponsored community meetings and events canceled. All that on the Union County website right now, and parents did get an alert on that a short time ago. Again, waiting to see what CMS does. They have that emergency meeting tonight. Lancaster County schools are closing.
Our South Carolina Bureau reporter Greg Suskin just learned the district will close for 14 days. Greg.
Yeah, that's right, and it's certainly causing all kinds of concern because Lancaster County here is not set up for online learning. That's something that's been piloted in a couple other districts, but not this one. And part of this county also doesn't have access to high-speed internet, so it's not exactly clear how this is going to work. But I have been told, as of now, teachers expected to report as normal here on Monday and work through this, try to get those work assignments out to their students while they're home. And the hope in that is if they can get enough work done over the 10 days that they're off, they can count those days as school days and not have to make them up, and also possibly still salvage spring break, which starts a month from today. But I'll tell you, after talking to people here today in Lancaster County, a district of about 11,000 students, and Kershaw to the south, they are scrambling right now to try to get all this together. Naturally, parents scrambling too, trying to juggle work schedules and childcare schedules and all that just to try to deal with something they didn't expect to deal with right now. Back to you.
Our Greg Suskin live tonight. Yeah, a lot of parents wondering what they're going to do. At least they have the weekend to figure things out. Thanks, Greg.
Now let's take a look at the possible impact on roads. This is the view right now live at I-85 and Sugar Creek. Now normally at this time of day when we take a look through these cameras, it's to show you how busy it is on the roadway. Typically at this time of day, I-85 and Sugar Creek would be packed for the evening rush hour, but as you can see in this shot, pretty light traffic moving along very smoothly. And a look at the morning drive. Take a look at what we captured this morning with the video. This was right before 9 a.m. on I-77 north of I-85. Not many cars out there at all. Probably more and more people working from home. And then a few minutes later, this is a look at I-77 southbound at Clanton Road. Again, this view also showing you a lighter look at the roadway. Somebody out with the dog, though, taking a run. Yeah. Well, to put all this in perspective, we want to show you some numbers. Just yesterday, the drive from Carowinds into uptown Charlotte would have taken you about 23 minutes because of all the congestion with no crashes. Now, that was around 8:45 in the morning. At that same time today, that same drive took you 12 minutes. So quite a bit of difference.
But you know the downside to that? The traffic in the middle of the day has been terrible.
Yeah.
I noticed when I came in at 2 o'clock today, the highways were packed, and it's never that way at 2 o'clock.
Maybe people just going out to grab something to eat. But it's not just roadways, though.
Yeah, let's talk to Channel 9's Ken Lemon tonight. Business owners feeling a lot of impact from these changes. Ken?
Yes, Scott, I spoke with one restaurant operator who told me he saw his first noticeable dip in business today. He pointed out that the people who were there, not his normal crowd, in part because Wells Fargo and other businesses uptown told their employees that they could work from home. One business that is glad to see folks now is the one right behind me. I'm going to zoom in right down there, and that is Patty Wax Candle Bar. I was in there earlier today, and there was very little business, no business at all. Walk-in business is slow, but even more worrisome. 70% of their business comes from groups making reservations for candle making classes. In the last few days, they had 80 classes canceled. Some of those were from people who were flying into Charlotte. This is supposed to be one of their peak periods.
We're in a spring break period, so normally business would be overbooked, and we would be telling people we don't have space in classes.
Yeah, and that's very different right now. As a matter of fact, they're trying to convince customers that they are washing down services, stressing washing hands, doing everything they can to prevent the spread of any disease in this case. And they also tell us that next busy period is going to be the Easter weekend. That's the next peak business period. They're hoping by that time people are more comfortable around crowds. It will certainly make them more comfortable, Erica.
All right. Thank you, Ken.
Well, tonight we turn to this. This graphic you may have seen is doing something they want to call flattening the curve. Basically, here's what health officials want to do about coronavirus. Instead of having this big spike in cases that drops off, they want to flatten the curve and have fewer cases, maybe stretching out over a longer period of time, but certainly a more gradual rise and decline. All new tonight at 6, our Joe Bruno is explaining how canceling all these events we've told you about could help to do that.
March Madness, the NBA, the NHL, bar crawls, concerts, parades, all of these events canceled. You might be asking yourself why. It all comes back to this phrase, flatten the curve.
If we look at the trajectory of this infection in other communities, the expectation that we are going to see escalation is real. The extent of it, we don't know.
The Panthers have keep pounding. If there was ever to be a rallying cry for us to battle COVID-19, it would be flatten the curve. Here's what it means. Doctors and scientists have come to the conclusion a whole lot of people are likely going to get COVID-19. The goal now is to make sure the hospital system isn't overburdened.
The overall number of infections is much less of a worry than how many of these infections occur at once.
Take a look at this graph. On the x-axis here, you have the time since the first case. On the y-axis, you have the number of daily cases. The healthcare system capacity is right here. Without protective measures in place, we could see cases soar, creating this huge spike. All of these coronavirus patients combined with people who need other treatments bogging down a healthcare system. The goal is to stop that spread, but until that happens, the next best thing is to slow it down. By canceling all of these events and practicing social distancing, it helps flatten the curve, spreading out COVID-19 cases, easing the burden of doctors, hospitals, and medical professionals.
That's all we can do at this point, is continue to try to contain.
All of these cancellations and postponements are aimed to flatten the curve and prevent situations like what is happening right now in Italy, where doctors are overwhelmed, hospitals are overflowing, and people are on lockdown.
And Joe, we also know you talked to the Mecklenburg County health officials, asking them why Mecklenburg County is only receiving 3 tests at a time for coronavirus.
This is just stunning to me. We are the state's largest county, and we only have access to 3 tests at a time. 3. How is that okay? I had to ask. JB, clarification, are you only getting 3 tests at a time from the state right now?
Yes.
How is that acceptable?
That's a good question. It is what they have available to give to us. They have 100 counties, and they're sending tests out across all of the counties at this point.
Why is that? I mean, whose fault is this? How is it that we're in the United States right now and we don't have enough supplies to test people in the midst of this pandemic?
That's not something that I can answer. We've seen mixed messages around testing, and we also know that the supply is just limited. So we're doing the best we can. We're working with ATRIUM, who has some capacity to test, and we're continuing to work with LabCorp, who has some capacity to test. But everybody's a bit limited at this point. Unfortunately, in this country, we're behind with our ability to test.
I asked the health director how many tests she needs. She told me significantly more than 3. One more important detail, though. These are the tests offered by the county health department. Hospital and medical groups are also offering limited testing.
Sounds like they may be demanding, but their hands might be tied at this point.
Enough tests for the number of people at this desk right now, all they have. All right, our Mark Becker live tonight at ATRIUM, where medical experts had a panel today, and they talked about what they want people to know about coronavirus. Mark?
Yeah, well, ATRIUM is one of the biggest hospitals here, and so it only makes sense that they would be right in the middle of it if a lot of people did test positive for the coronavirus. And so they convened a panel of doctors here today, even a chaplain, to talk about where they are right now and what concerns people may have about the virus. And apparently there are a good number of them, because one of the doctors here today said that the number of calls coming in with questions about the coronavirus has tripled over the last week or so. The panel was here to answer some of those questions and to hit several key points, starting with how you might tell the difference between the flu that we're used to and the coronavirus. Well, one doctor said the flu hits hard and fast, while coronavirus symptoms are more gradual. It may take actually a week to ramp up to full onset. They also say don't travel if it isn't necessary, and if you do travel, go by car. It's probably safer. They're saying don't get elective surgery. The hospital space may be needed for patients who need it more, frankly. And they suggest limiting your social media exposure to filter out wrong information and preserve your own sanity. The bottom line here is that the hospital says they are geared up now for whatever comes next.
Are we prepared in our hospitals? I do think we are. I think we have really ramped up our ability to take care of folks who are critically ill. We've luckily not seen an onslaught of critically ill folks in our communities yet.
One other point they made here is that while it is important to keep that social distancing we've heard about in your mind, 6 feet, to keep from getting infected, it's also important not to get isolated, particularly if you are being tested for coronavirus. You need support. You need social support. They say that is important. Back to you guys.